Okay, hey guys, it's Summer. My clinical pattern was a total elbow arthroplasty, or TEA. This procedure consists of replacing the damaged parts of the humerus and the ulna with artificial components. The artificial elbow joint is made up of a metal and plastic hinge with two or three metal stems which fit into the humerus and the ulna. There are many different approaches to handling the triceps, so refer to my clinical pattern for further details on that. For patient demographics, the average age is 58 years old, and this is traditionally for elderly, low demand patients. For gender, women are more affected than men, and one study found it mostly affecting white females. The best outcome tool to use for this is the Mayo Elbow Performance Score, or MEPS, or the Quick Dash. For the mechanism of injury, which leads to the TEA, it's usually rheumatoid arthritis, osteoarthritis, post-traumatic arthritis, severe fracture of the distal humerus, degenerative changes, or tumor reconstruction. And for need of systems review or review of systems, I would just make sure to screen for any signs or symptoms of infection or serious illness, especially since most of these patients are older and they already have some kind of disease or degenerative changes. Precautions and contraindications to treatment and for the exam. Range of motion should adhere to any restrictions issued by the surgeon. If no restrictions apply, then range of motion is based on patient tolerance. There's no resisted testing during the PT exam. No lifting of objects greater than 1 pound with the upper extremity that was operated on, and no lifting anything over 15 pounds for the rest of their life. You want to avoid varus and valgus stress to the elbow, so avoid excessive reaching across the body for ADLs. No upper extremity weight bearing with the involved side, and no assisted device for ambulation should be used with the operative upper extremity. And no upper extremity pushing motions against resistance, so like opening a door. And they can not do any tennis or throwing activities for the rest of their life. Moving to the physical exam, on observation, you should expect to see a healthy incision site on the back of the elbow with sutures and staples. Inspect for signs of infection and note the healing progress. A drain may still be present to remove fluid from the joint. Pain, swelling, erythema, and ecchymosis may also be present. For active movement testing, again, range of motion should adhere to any restrictions issued by the surgeon. If no restrictions apply, then range of motion is based on patient tolerance. It will likely be limited and painful initially, post-op in all directions though, so elbow flexion, extension, supination, and pronation. For passive movement testing, gentle elbow range of motion can be performed to patient tolerance if no restrictions apply, but it will likely be limited and painful in all directions with empty infields. There's no resisted testing, no accessory mobility, no neurodynamic testing, no special tests. On palpation, you can find tenderness at the elbow and throughout the involved upper extremity, and you may feel extra fluid around the joint, which is edema. You may see inflammation, and you may feel warmth. For diagnostic testing, they may have had radiographs taken before and after the TEA. For signs and symptoms indicating a referral to a physician, those things would be infection, delayed progress in rehab or the healing of the wound, signs of ulnar neuropathy, implant problems or failure, such as breakage or aseptic loosening, and triceps insufficiency. And then surgical indicators, obviously this is a surgical procedure, but a TEA revision surgery may be indicated if the original TEA has failed due to infection or a serious mechanical problem. And just to keep in mind, during the physical exam, you do want to work on the triceps since that's a major thing during this surgery, and patients need to have as much triceps function for ADLs as they can, so just keep that in mind. But I also included a post-surgical protocol in my clinical pattern, so you can refer to that for further details on treatment. Thank you.